As the coronavirus pandemic spreads throughout the United States and throughout our community, practicing responsible social distancing and isolation is an effective way of preventing the spread of the virus. Symptoms of coronavirus can develop anywhere between 2 days and 2 weeks, and for those isolating themselves in their homes, every time they leave their home resets that 2-week clock when symptoms can develop. Unfortunately, not everyone can stay home in this time. Those who aren't displaying symptoms may still be working essential jobs, or you may have to go to the grocery store once a week when supplies run out. Before leaving your home, there's a few things you can do to prevent yourself from being exposed to coronavirus. When you go out, make sure to wear clothing that covers as much skin as possible, like pants or long-sleeve shirts. If you have long hair, pull it up into a ponytail, and try not to wear any earrings, bracelets, or rings. This way, you'll minimize the urge to touch your face, as we sometimes subconsciously touch our hair or jewelry, and minimize touching the face when jewelry is removed. If you have a mask, make sure to use it right before leaving your home. Try not to use public transportation, such as buses, planes, or trains. If you go out with your pet, try not to let it rub against public surfaces that might have been contaminated by the virus. Bring disposable tissues with you, and use them to cover up your fingertips to avoid touching surfaces. After using tissues to prevent touching a questionable surface, make sure to crumple them up and throw them away, and close the bag or close the top of the bin to prevent them from blowing away. It doesn't help contain the virus if the tissue exposed to it is blowing around and touching other surfaces. If you cough or sneeze, do it into your elbow, not into your hands or in the air. Try not to pay in cash, and if you do pay in cash, make sure to disinfect your hands afterward. Wash or disinfect your hands as often as possible when touching questionable surfaces. And make sure not to touch your face until your hands are clean. Keep your distance from others. Even if they don't display symptoms, they may still be able to spread the virus. After returning home, there's a few steps you can do to further minimize your exposure. Try not to touch anything when you first walk inside. Take off your shoes. If you've walked your pet, disinfect their paws. Take off any exterior clothing and put them in a bag to wash. Leave your bag, wallet, keys, etc. in a box at the entrance of your home. Carefully take off any gloves that you may be wearing and wash your hands. Take a shower and thoroughly wash any exposed skin. Clean your cell phone and glasses with soap and water or alcohol. Clean all surfaces with bleach. The bleach to water ratio is 20 milligrams of bleach for every 1 liter of water. Remember, it's impossible to do a complete disinfection. The objective is to reduce the risk. Living with someone at risk who is displaying symptoms of coronavirus is a tricky matter, but there are actions you can take to help prevent yourself from becoming infected. Firstly, keep your distance. Sleep in separate bedrooms and use different bathrooms, making sure that you disinfect them with bleach after using them. Make sure not to share towels, cups, cutlery, or any other objects that is normally shared between yourself and the person at risk. Clean and disinfect all surfaces that the at-risk individual comes in high contact with daily. Wash clothes, blankets, and towels often. If you do start developing symptoms of coronavirus, such as a cough, tightness in the chest, or a fever with a temperature above 101 degrees Fahrenheit, call our designated nurse advice line, and a certified nurse will evaluate your situation and determine whether a further appointment needs to be made or if the situation is critical enough to warrant urgent care or a trip to the hospital. All of these preventative measures are habits that we're not used to making in our everyday life, but with coronavirus in the community, they are essential at slowing the spread of the virus and keeping ourselves safe.